Now the cardiac cycle, atrial systole before ventricular systole in that diagram, and diastole. So yeah, the cardiac cycle is how the heart contracts, the sequence of how the chambers contract and relax and pump blood. And in combination with the valves, that's how your heart is able to maintain the flow, the correct flow from the great vessels and to the chambers of the heart and from the heart itself. Now, so I'd like to draw an analogy between the cardiac cycle and the stages of, now I'm not auto mechanic, but I know, or maybe I took that class all the way in intermediate school, but it's kind of like the cylinders. What you're doing is that you have the fuel in here, and then you have the ignition right here, and then you have the fuel being, or it's been a long time. I probably fail it right now. But what we have here is the gas coming in and the fuel injection. So this is how you're able to generate your motor, right? So this right here in the cylinders. I know my teacher would be so disappointed in me right now. But what I'm getting at, that's like a cycle. It happens over and over to run your motor and turn the wheels in your car. Now the conduction system of your heart, instead of being the chambers of your heart, it's actually more like the electronic wiring. So it's like how you have the electric wiring in your car, especially if you have a Tesla that starts everything. The conduction system is like that in your heart. So it's kind of like the electrical activity that coordinates this activity right here. So that's what your conduction system is. So the conduction system, this involves specialized cardiac muscle cells and fibers. So the thing is that common misconception with the conduction system of the heart, these are not nerves. They are actually cardiac muscle cells or cardiomyocytes. But some things make them a little special. Instead of being contracting like all the rest of your muscles, they're more about generating electrical signals called action potentials and distributing them throughout the heart. And these things we call action potentials, these tell the other cardiomyocytes, these heart muscle cells, to contract. So the interesting thing about the cells that are part of the conduction system, again, they are actually specialized muscle cells. They are not nerves. They don't have that myelin or any of those synapses like you see in nerves. And actually they do have actin and myosin, but less so than the heart cells that make up the walls of your atria and ventricles. So yeah, this is what we have here, and these are cardiac cells. So what this person, Dr. Gluck at the California Institute of Regenerative Medicine, this is a common practice now. What you can do is have stem cells that can differentiate into, and remember, differentiate is like when a stem cell kind of becomes more specialized. So what you can do is grow a bunch of stem cells and actually add chemicals that make them develop into cardiac cells. And what we have here, these were originally stem cells. Then you add chemicals that allow them to differentiate into cardiac muscle cells. Yeah, so these cells, they don't have any electricity being applied to them. They're beating on their own. So this is a cool thing about these specialized cardiac muscle cells. All right, so this is the conducting system of the heart, starting from the beginning of a cardiac cycle. So it starts at what you call the sinoatrial SA node, sometimes just simply sinus node. Then it goes through these internodal pathways. I think that if more specifics on that should be more of a medical school level question. But then it goes to this AV node, again, atrioventricular, so implying that's between the atria and ventricles. Then it goes to the AV bundle, also known as the bundle of His. You should know both terms because a lot of older medical textbooks, they use bundle of His, and actually it's a pretty common term, so you should know both, that AV bundle equals bundle of His. Then it goes to the bundle branches over here, and notice it's going toward the left and right ventricle. And then you have its common name, Purkinje fibers. I think the original pronunciation is more like Purkinje or something like that. I don't speak, was it Czech? I forgot, or Polish. But yeah, whatever it is, like most people say Purkinje or something like that. Also known as subendocardial branches. So you should know both because Purkinje fibers, I think almost all health professionals know what Purkinje fibers are. So you should know these names that are named after people. Like it's not bundle of His, like as a pronoun. It's actually someone's last name. So this is a mnemonic I like. I actually learned it from a student. So the mnemonic is save, and then you hold out the save. Why? Because it's going from the SA to the AV. Save his. So again, this is why it's referring to the bundle of his. And then bunch. So bunch of refers to bundle branches. So don't get these two mixed up. And then perks, as in Purkinje fibers. So save his bunch of perks. That's like one of my favorite mnemonics. Like it tells you the order of this conduction system. You generate the action potentials in the SA node, and it travels in this sequence through all of these parts of the conducting system. All right, so then where does a cardiac cycle start? So again, remember that the cardiac cycle is starting in which contracted first, the atria or the ventricles. Actually, that's that. Hopefully the chat works. Which contracts first in the cardiac cycle, atria or the ventricles? I know it's on loop here, but in that previous circular diagram, which contracted first? Yeah, so it looks like most of you got the atria contracted first in the cardiac cycle. So remember, both were relaxed, so the atria were filling, but now the atria are going to squeeze blood into the ventricles. Alright, so the other thing is like, not only where does it start, notice that all these contractions, well, it is a GIF in this place, but remember that beating heart we saw earlier? Notice that the heart was not only able to initiate its own contraction, it was also maintaining a constant rhythm. It wasn't erratic, it wasn't like, let's beat for a few seconds, stop, and then beat again. Notice that it was a constant rhythm. And this is what's interesting about the conducting system. You have your own natural pacemaker. You might have heard of like artificial pacemakers for the heart, but the heart has its own built-in pacemaker, and these specialized cells help not only to initiate the contraction or the conduction system, they also help to maintain a beat. So the big population that you definitely should know are the pacemaker cells in the SA node. Then you have the AV node, which also has a secondary population of pacemaker cells. Yeah, this is, I think, good to know, but yeah, you should definitely know the first.